Ensure that the appropriate patient sector in the central monitoring system has been activated. For telemetry monitoring, insert a battery into the telemetry transmitter. Turn on the bedside monitor. Determine whether the patient is going to be monitored with a 3-lead or 5-lead system. Check the cable and lead wires for fraying, breaks, or discoloration. If equipment is damaged, obtain alternative equipment and notify the biomedical engineer for repair. Plug the patient cable into the monitoring system or telemetry transmitter. Check that the lead wires are plugged into the patient cable correctly and securely. Manufacturers identify the lead connections by color, letter, or symbol codes. 3-lead system. The negative wire plugs into the opening marked N, minus, or RA, usually white. The ground wire plugs into the opening marked G, neutral, or LL, usually red. The positive wire plugs into the opening marked P, plus, LL, or LA, usually black. 5-lead system. The right arm wire plugs into the opening marked RA, usually white. The left arm wire plugs into the opening marked LA, usually black. The left leg wire plugs into the opening marked LL, usually red. The right leg wire plugs into the opening marked RL, usually green. The chest wire plugs into the opening marked C or V, usually brown. Connect the electrodes to the lead wires before placing the electrodes on the patient. When using a 3-lead system, select a lead. Lead 1, Lead 2, Lead 3, MCL1, MCL6. When using a 5-lead system, select a lead. Select V1 as the first choice. Substitute V6 for V1 when the patient cannot have an electrode at the sternal border, or when the QRS complex amplitude is not adequate for optimized computerized monitoring. Select the limb leads appropriate for the clinical situation. Select EASI 12-lead monitoring if a view of 12 leads is needed. Identify the sternal notch or angle of Lewis. Palpate the suprasternal notch at the juncture of the clavicle and the sternum. Slide the fingers down the center of the sternum to the obvious bony prominence, the sternal notch. Locate the 4th ICS. Wash the patient's skin with soap and water and dry it briskly with gauze pads or a washcloth. Remove the backing from the pre-gelled electrodes and test the centers of the pads for moistness. Place the electrodes on the patient. Apply electrodes by pressing around their entire edges. Do not press directly on the gel pads. 3-lead system, MCL1 and MCL6. Place electrodes as follows. Apply the RA electrode close to the patient's left shoulder near the junction of the left arm and torso. Apply the LA electrode at the 4th ICS right sternal border. Apply the LL electrode at the 5th ICS at the mid-axillary line. Select lead 1 to obtain MCL1 and lead 2 to obtain MCL6. Lewis lead system. Place electrodes as follows. Apply the RA electrode at the 2nd ICS right sternal border. Apply the LA electrode at the 4th ICS right sternal border. Apply the RL electrode at the level of the lowest rib on the right abdominal region or on the hip. Apply the LL electrode at the level of the lowest rib on the left abdominal region or on the hip. Set the lead selector to lead 1. 5-lead system lead placement. Place electrodes as follows. Apply the RA electrode close to the right shoulder below the clavicle. Apply the LA electrode close to the left shoulder below the clavicle. Apply the RL electrode just below the rib cage on the right side. Apply the LL electrode just below the rib cage on the left side. Apply the chest lead electrode on the selected site, V1 at the 4th ICS right sternal border or V6 at the 5th ICS left mid-axillary line. Set the lead selector or monitor the appropriate leads. EASI system lead placement. Place the E brown electrode on the lower part of the sternum at the level of the 5th ICS. Place the A red electrode on the left mid-axillary line at the level of the 5th ICS. Place the S black electrode on the upper part of the sternum. Place the I white electrode on the right mid-axillary line at the level of the 5th ICS. Place the 5th ground electrode anywhere on the patient's chest. Reduce tension on the lead wires and cables. For hard wire monitoring, fasten the lead wire and patient cable to the patient's gown, making a stress loop. For telemetry monitoring, secure the transmitter in a pouch or pocket in the patient's gown. Display the patient's ECG tracing in 2 leads, if available. Examine the ECG tracing on the monitor for the size of the R and T waves. Obtain an ECG strip and interpret it for rhythm, rate, presence and configuration of the P waves, length of the PR interval, width of the QRS complexes, presence and configuration of the T waves, length of the QT intervals, presence of extra waves, for example, U waves, and presence of arrhythmias. Customize the alarms to meet the patient's needs. Adjust the upper and lower limits based on the patient's current clinical status and heart rate. Set the ST segment parameters and the QT interval monitoring if indicated and available.